What if a disease everyone thought was defeated suddenly came back stronger, faster, and more dangerous than before? What if something from the past, something most people under 30 have never even seen, started spreading again in schools, airports, shopping malls, and neighborhoods? That is what's happening right now with measles. A virus that should have stayed in history is pushing its way back into the world, and the speed of its return is catching everyone by surprise. People think of measles as a kid's rash, something mild and simple. But the truth is much darker. And the way it's spreading today is something experts hoped they would never see again. For decades, measles was almost gone. Vaccines turned it into a rare disease in most countries. When enough people got both doses of the MMR vaccine, the virus had nowhere to go. It couldn't jump from one person to another. Communities reached herd immunity, the safest kind of shield a society can build. In some places, measles cases fell to zero. Entire generations grew up without knowing how serious the virus really is. Many parents never saw a child with measles. Many doctors trained for years without ever treating a single case. The disease became almost invisible. But the virus didn't disappear forever, it only went quiet. Over the past few years, the shield that once kept measles out began to weaken. Vaccine coverage started slipping, slowly at first and then faster. Some kids missed their second dose. Some families delayed routine health visits. Some communities had large groups of unvaccinated children living close together. It didn't take long for those gaps to become cracks. And those cracks became doorways. Measles didn't need a wide opening to return. Even a tiny space was enough for it to slip back into the world. Then something happened that changed everything at the same time for nearly every country, the COVID-19 pandemic. During the pandemic, health systems were pushed to their limits, clinics shut down. Nurses and doctors were moved to emergency roles. Parents avoided hospitals. Vaccine appointments were postponed or canceled. Millions, literally millions, of children missed their scheduled vaccinations. And because measles is so contagious, even a small drop in vaccination rates is enough to spark outbreaks. When vaccination coverage falls in many countries at once, the risk becomes global. After international travel reopened, measles found the perfect environment to return. Someone infected in one country might feel fine while traveling. Symptoms can take days to appear, but the virus spreads long before the rash shows. That means a traveler could walk through an airport, sit in a plane, visit a mall, or attend a crowded event and unknowingly infect dozens of people. By the time the first person gets sick, the chain reaction is already done. The virus has moved on to new homes, new families, new places, and the numbers prove how fast this comeback is happening. By 2024 and 2025, measles outbreaks hit almost 60 countries. Some nations reported their highest case numbers in 20 years. Health departments that once saw only a handful of cases a year began reporting hundreds. Some schools had to send entire classes home. Parents who never worried about measles suddenly faced exposure notices, and doctors who had never seen a case had to race to catch up. But here's what experts say is even more frightening. The world today is more vulnerable to measles than it was 30 or 40 years ago. Measles hasn't changed, but we have. Measles is one of the most contagious viruses known to humans. If an unvaccinated person walks into a room where someone with measles stood 2 hours earlier, the virus can still hang in the air. That person can get sick without ever being in the same room at the same time. Almost every unvaccinated person who comes into contact with measles becomes infected. That is why outbreaks move so fast, sometimes doubling in size within days. Now, combine that contagiousness with the fact that immunity gaps now exist in almost every part of the world. Because so many children missed vaccines during the pandemic, measles has a massive pool of vulnerable people to infect. It doesn't matter if a country is rich or poor, small or large. Once vaccination rates fall even a little, the virus spreads like wildfire. There's another problem too, one that experts don't like to talk about but is becoming clear. A whole generation of parents and young doctors simply forgot how dangerous measles is. They've never seen it. Some don't realize how quickly it can kill. Because measles became rare, many people started relaxing. Delayed diagnosis has become common. Symptoms such as fever, cough, and runny nose look like a normal cold for the first few days. When doctors don't expect measles, they don't test for it, and they don't isolate the patient. That delay gives the virus even more time to spread. This is part of why today's outbreaks feel worse. Not because the virus has changed, but because the world around it has. Our guard is down, our systems weren't prepared. And measles knows exactly how to take advantage of that. So who is in danger now? The answer is simple: anyone who isn't protected. Children under 5 face the highest risk. They can develop pneumonia, severe breathing problems, or swelling of the brain called encephalitis. Measles can weaken the immune system for months, making kids more likely to get other infections later. Some children recover only to face long-term health issues that last for years. Adults with weak immune systems can get seriously ill as well. And the scariest part? Babies too young to get the vaccine depend entirely on the immunity of the people around them. If the community is not protected, the baby is exposed with no defense. There's one more piece almost no one talks about, and it might be the scariest part of all. When measles infects a child, it doesn't just make them sick for a week. It can wipe out parts of their immune system, almost like pressing a reset button. Scientists call it immune amnesia. After measles, the body forgets how to fight other diseases it once knew how to handle. A child who had protection against things like pneumonia, flu, or ear infections suddenly becomes vulnerable again. It's as if measles steals their memory of every battle their immune system ever won. This means the danger doesn't end when the rash fades. It can last for months or even years. That's why communities with measles outbreaks often see other infections rise afterward. The virus breaks down the body's defenses and leaves the door open for everything else. This hidden effect is what experts fear most. It shows that measles isn't just coming back, it's changing the health of entire generations in ways many people still don't understand. In 2024 alone, about 95,000 people died from measles. Most of them were young children. Almost every death could have been prevented with a vaccine. That's what makes this comeback so heartbreaking and so frustrating. A safe, cheap, effective vaccine exists. But measles still finds ways to spread where vaccination rates fall. Even wealthy countries aren't safe. The United States, the UK, France, Germany, Japan, all have reported outbreaks in the past 2 years. Some had more cases in a single month than in entire decades. Cities that once celebrated being measles-free are now sending out emergency alerts. The virus doesn't care how advanced a country is. It only cares whether enough people are immune. And right now, that answer is often no. This is why experts say the world needs to pay attention again. Measles is not a soft, harmless childhood infection. It's a fast-moving virus that can overwhelm health systems, shut down schools, and hit the most vulnerable people the hardest. And once it gets into a community with low vaccine coverage, stopping it becomes extremely difficult. The bigger picture is now clear. Measles is coming back because the shield that once protected the world has cracks created by missed vaccines, weakened health systems, rising fears, mixed information, and global travel. The virus didn't get stronger. It simply found us off guard. And here is the most chilling part. If the world does nothing, measles could become a normal part of life again. Something children catch every year. Something that sends kids to hospitals. Something that causes lifelong health problems for thousands. Something that once again becomes a major killer. This virus should have stayed locked in the past. But now it's reminding the world of what happens when protection fades. Measles isn't just coming back, it's warning us. A disease everyone forgot is showing the world what happens when the shield comes down, and it's not done yet. If this video helped you understand the real danger behind the measles comeback, hit like, share it with someone you care about, and subscribe for more clear health stories that matter.